for joining us for our mental health mini webinar today. Just a couple of quick housekeeping items. This webinar is being recorded and will be posted on our page for later reference. Please remember to mute yourself. There will be a chance for a question and answer at the end, so feel free to chat in your questions during the webinar and we can be sure to address them at the end. Today's discussion will be focused on supporting the mental well-being of caregivers, older adults, and family members during this time of COVID. We will hear from St. Peter's Health Clinical Psychologist Dr. Kaile Ross and Rehab Director for Cooney and Elkhorn Healthcare and Rehabilitation, Amy Lende. And now I will start by turning it over to Dr. Ross.
Hi there, Haley. Thank you for that wonderful introduction. I'll be giving a 10 or so minute presentation just about senior mental health and what that's looked like in particular during these last several months during the COVID-19 pandemic. Let me see if I can figure out how to share my presentation with you. Here we go. Okay, hopefully you can see my slides right now. So as I mentioned, I'm going to be talking about mental health in the senior population and what that's looked like during the pandemic months. So as Haley mentioned, I'm a clinical psychologist. So for training, that means I wear two hats a lot of times. I'm trained both in the research and science side of things, but also as a clinician as well, and seeing patients one-on-one and hearing their stories. And so during this time of COVID, I've heard a lot of how people have managed over the last several months, changes to mental health, levels of stress, those sorts of things. So as a scientist, my big question is, what does the data show us about how folks are doing in terms of their mental health during the pandemic? So to look at this, I first found a recent study from the CDC looking at just this question. And again, I'll draw your attention to this, even though this study just came out last month. They're looking at mental health the last week of June in particular. And what they found, so they interviewed over 5,000 adults here in the United States, and they found that a little over 40% of adults had at least one indicator of really poor mental health. So that would be a combination of anxiety or depression, trauma or stress related specifically to the COVID pandemic. And then they also looked at substance use or to cope with stress. So they asked the question of, have you recently started or increased your substance use to cope with the stress from the pandemic? So about 13% of people, adults in total, said yes to that question. So even as of June, we're seeing some shifts in poor mental health happening as a result of the pandemic. But I wanted to specifically look at our seniors. And I know these numbers are a little bit tiny on your screen, but bear with me. What it did is in this study, they broke it down by age group. And so the take-home message for this is that in the 65 and older group, what you're seeing is the lowest rates actually across the board for anxiety, for depression, for trauma and stress related symptoms for the pandemic, for substance use. All of those categories, those who are 65 and older are actually reporting the lowest numbers. So overall, demonstrating the best mental health of all age groups. And again, this is data coming from June. So I also want to see more recently what this is looking like. So the Census Bureau also did a survey called the Household Pulse Survey, where they repeatedly, week after week, tried to survey US homes to get a sense of how things are going in the middle of COVID. So this recent data, they're looking at over 90,000 people who responded to this survey and looking at people who screened positive for anxiety and or depression. And so again, they broke it out by age groups. And similarly, even though these numbers are a little bit higher, those who are 60 and above, again, are demonstrating the lowest rates for depression and anxiety. But I'd also like to point out that even though these are the lowest rates, you could see the 60 to 69-year-olds, you're still reaching about a 30% of that age group reporting symptoms consistent with an anxiety or depression disorder. So even though that's much lower than the young adult population, who's reaching almost about half of people experiencing depression or anxiety, the older folks in the 60 to 80 and above category are doing much better, but still experiencing significant rates of depression and anxiety. So switching back over to my clinician hat, because I've had lots of conversations with people about their mental health and how they're dealing with the stress of the COVID pandemic. So one of the things I would like to point out that we do know about how folks are managing things is that those with prior mental health history, so anyone who's had anxiety before, PTSD, depression, bipolar disorder, anyone who's experienced those puts them at a much higher risk of experiencing significant stress, depression, and anxiety. Because if you think about it, they're already dealing with kind of fluctuations in their mood that they've experienced ups and downs in the past. And so the COVID and number of other things going on in sort of these unprecedented times adds another layer of stress that then kind of increases the vulnerability for an onset of anxiety or depression. The other thing I tried to look at is looking at nursing home data, because a lot of these surveys look at folks who are in their homes still able to complete an online survey, but not necessarily looking at the folks who are living in nursing homes, in long-term care facilities or residential facilities. And what we do know is that that population has been in the spotlight in the news because of their vulnerability for COVID-19. And yet the data is kind of lagging behind. We don't have good data on how folks are doing in those facilities. But we do know is that being in a nursing home, long-term care, people are at higher risk, both because there's higher rates of dementia, higher rates of comorbid medical conditions, but also just higher rates of depression and anxiety in general. And then also individual differences. So I think I've seen plenty of individuals who are 65 or above without any pre-existing mental health conditions and still experiencing a significant amount of anxiety around the COVID disorder. So sometimes a stress like this can hit somebody just right that it can tip off an anxiety disorder or a depression, even if there aren't any pre-existing factors. And then this last piece I want to touch on, especially for the senior population, is social isolation. So what we do know from the literature is that social isolation, loneliness, those are things that, especially in the senior population, the more those things are present, the higher the risk is for poor medical outcomes and poor mental health. So the more social isolation, loneliness, lower connectivity, those things put people at higher risk for poor cardiovascular outcomes, for depression, for anxiety, for those things. But on the flip side now, with the COVID pandemic, those things are more and more constrained because as people are more social, that increases their risk of COVID infection. And so seniors in this population in particular are caught in this double bind of social isolation and loneliness causing long-term negative effects, but social isolation in this short term causing anxiety, depression, those sorts of things. And those who are engaged more often in social activities are actually increasing their risk for COVID infection. So it's sort of a catch-22 for the senior population, being able to manage and juggle that really challenging balance of what to do with the two. The last piece I wanted to touch on is the impact specifically on caregivers. So for the senior population, for those who need a little help getting through their day, or a lot of help depending on the person's mental and physical well-being, a lot of folks rely on unpaid caregivers. So one of the surveys specifically looked at folks who are unpaid caregivers. So these are people who are providing care for adults, usually family members or close friends, but that's not necessarily their primary job. They're not getting paid to be in this role. So typically these are people who are wearing multiple hats. So these are people who are maybe caring for a sick spouse or caring for an ailing parent. And then they're also burning the candle at both ends, where a lot of times it's a person taking care of an elder parent, but also taking care of school-age children as well. And so what the survey shows is that this group in particular demonstrates very high rates of anxiety. So about 48%, high rates of depression, high rates of stress and trauma related to COVID, increase in substance use as a result of the COVID pandemic. So that coming in at a little over close to a third of people reporting that, who are the unpaid caregivers. And then similarly, suicide thoughts, also about a third of the population of unpaid caregivers, just because of the amount of stress going on during this time period. And then also they looked at essential workers, and similarly, they found really high rates of anxiety, depression, trauma, and stress-related symptoms related to the pandemic, and then substance use increases and suicidal thoughts. So for both of these groups, I wanted to highlight because these are the people who are taking care of our senior population, for those who need the extra care and support. And so I wanted to shine a light on this because these are people who are working very hard and might be suffering the most in terms of negative impacts on their mood because of the COVID pandemic. So in thinking about what this all means is, I think on the large scale, it shows that senior mental health is not as bad as some other age groups. So seniors are actually faring pretty well, all things considered. And that is consistent historically too, that the senior population tends to have much lower rates of mental health issues. Currently, those rates are slightly higher, but again, much lower than other age populations, specifically when you compare it to young adults. That being said, there are people who are struggling, and I just want to highlight that it is okay to not be okay right now. So again, reflecting on that, we are in unprecedented times in terms of the amount of stress that the COVID pandemic has placed on individuals. And to think about, especially as a clinical psychologist, I talk with a lot of patients about noticing how we talk to ourselves. And a lot of times that we can be very supportive of other people, but that we can be very hard on ourselves. And so this quote just struck a chord with me in terms of how we should think about our mental health during these times. So it says, "You will never speak to anyone more than you speak to yourself in your head. Be kind to yourself." I want to transition to talking about mental health and things that we can do for ourselves and for seniors that we work with in terms of improving mental health. One thing I would just put out there is taking breaks from the news, or being intentional about seeking out upbeat news. So here are two recent headlines I put in this category that just kind of bring a little bit of a smile to your face and a little bit of a break from kind of the doom and gloom. So a 102-year-old New Hampshire woman survives both COVID-19 and the 1918 Spanish flu. And then the good news that as of September 17th, at least, COVID-19 cases are back on the decline. So again, realizing that if the news is all doom and gloom, if you spend too much time focusing on that news, then your mood also can start to become doom and gloom. Other aspects of improving mental health, we're fortunate here in Helena of having great access to the outdoors and nature. So there's a lot of research supporting even just sitting outside in nature for 20 minutes a day can have kind of the same effect as even taking an antidepressant medication. So taking advantage of that and just sitting outside or getting outside for a walk. And then looking at this wellness wheel here on the side of just focusing on maybe one area for improvement. When things are really stressful, we, myself included, tend to stop engaging in certain activities. So sometimes we might not eat as well when we're stressed, or we might not spend as much time sleeping, or might not spend as much time connecting with family and friends. But then catching that when that happens and realizing those are actually the things that continue to help us feel well. And so being intentional about noticing if you've had any changes in that wellness wheel and see if there's one area that could use a boost, an intentional focus on improving. And then here's a couple resources as well for mental health. NAMI has some great resources specific to COVID-19 and COVID-19 anxiety, great information. And then also SAMHSA as well has a 24-hour hotline. If you're struggling with substance abuse or mental health, they've got great people there available to help you get connected with mental health services, substance use services, and just point you in the right direction. And also the suicide hotline for anyone who's experiencing risk of suicide or concerned about themselves or a loved one. You can always call the suicide hotline 24 hours a day. Then I'll just leave us with a few other options. The nice thing about the COVID pandemic is it has made telemedicine and telehealth a widespread option for many people. And so for folks who are still concerned about getting out of the house and being around other people in terms of being able to protect yourself from COVID-19, there are lots of good options for teletherapy these days. So I always recommend talking with your primary care doctor if you're at a loss for where to get started in terms of getting help with mental health. The website Psychology Today is a great resource for navigating, finding folks in Helena specifically in terms of getting connected with counselors or therapists. And then also looking at smartphone apps. There's a lot of great apps that are even free on the phone for helping people manage anxiety, stress, even helping manage depression and those things. And then the last piece I'll leave us with is staff and caregivers. What we do know is that especially unpaid caregivers, but paid caregivers as well, they tend to not be, because they're focused on somebody else's health and their needs, a lot of times they neglect their own medical care. And so that's a piece I'll leave folks with, is making sure that you, during this time of stress, are regularly going to your medical checkups, getting the care that you need, and then also engaging in employee assistance program services if you have access to that for free behavioral health support during this time. So I know that was a whirlwind of information being thrown at you, but I would say the take-home message is seniors as a whole, on average, are faring fairly well in terms of anxiety and depression, particularly in comparison to other age groups, but that we are still seeing some rise in anxiety and depression related to the COVID pandemic. And then there is a lot of support and a lot of help available. And using these slides as a resource to get connected.
Thank you, Dr. Ross. And I think we will turn it over for a moment here to Amy Lende to see kind of a brief description of kind of what you are seeing and hearing from your professional and personal experience of the caregivers and seniors and family members.
Yeah, thank you so much for having me. I'm very happy to be here today and kind of share what we're seeing and kind of what the all across the board in long-term care, what we are seeing. So I'm going to talk firstly about our residents and kind of the impacts and the influences that isolation is having on their mental health and depression. And I think isolation has really increased their fear. And so there's a lot of fear of illness and death. And with the COVID-19, so that is definitely not helping with our mental health. But they're also fearing isolation. So they fear to get sick, to have to go to the doctor, to have to maybe go back into an isolation room when their social contacts have been pretty cut off in long-term care facilities. So having them seeking getting help, one for mental health and just for their health in general, has been difficult. So there's a lot of groups working on the impacts with telehealth to try to get people health care where they're not so afraid of being isolated. Some of the effects that we're seeing with the isolation for these guys is that their normal day-to-day routines have changed, and some don't always adapt well to that change. And when these folks are living in facilities, their social networking with meals with their other colleagues and cohorts in the facility is it's really important for them, and it's really important that they those schedules stay, and they go and have scheduled meals, and they take more fluids in when they have those things. So we are seeing some unintended signs and symptoms of depression with weight loss and dehydration because they're just not eating as well as they do when they are socially with them. And I think for the staff members trying to assess their levels of depression, they're always looking for isolation and withdrawal as kind of a typical sign and symptom. And with isolation in the within the COVID pandemic, it's kind of hard for them to assess that. So we're, constantly working on new tools to help us with that. Let me briefly kind of talk a little bit about some of the staff issues. Staffing's always been a concern with healthcare in general, and with the increased stress and illness and any COVID signs and symptoms, it's just put a lot of increased stress on our staff and our workforce. So people are working longer hours. They're taking on a lot of fear of being the person that might bring in COVID-19 into a facility and being the one that would infect them, or taking it home to their family members. So those stresses are increasing, a lot of the mental health issues they're seeing just as essential workers. And then there's a lot of the other stresses of, our kids going to go back to school and having to work on paying for childcare that they're not used to when we have school 5 days a week. So I think a lot of those stresses are pretty common to the healthcare workers being seen. And I think Dr. Ross made a really, really good point that one area that's difficult is getting everyone to unplug a little bit from the media, from the hype and the fears. They're already stressed from work, or these residents are already stressed being in isolation, and the news is on 24/7. And so trying to find that positive news source or just unplugging for a while is a great recommendation. So I think at this point, that's a lot of what we're seeing from our staff and our residents in the long-term care settings. And I think I will hand this back for some question and answer.
Thank you, Amy. I think there are a few questions that we had discussed. Dr. Ross, if you wouldn't mind clicking to unshare your screen, and then you and Amy will pop up a little bit bigger on our screen here.
Wait, would you mind telling me how to do that?
You just did it. You did great.
Oh, I just did it. Oh, perfect.
Yeah. So I was hoping to transition briefly into kind of a little bit of a interview kind of situation. If Amy, you have any questions that you would like to ask Dr. Ross, or vice versa.
Yeah. How do you suggest that we foster and support mental health well-being of our seniors during COVID-19?
That is such a complex question. And especially finding that balance between doing it safely for the safety of the residents, but then also finding that balance between, I think people we love, we want to keep them in a bubble and keep them safe from everything, but then also realizing the unintended consequences of that. Like you mentioned, that social isolation piece and loneliness. So I think starting to get very creative with what our options are and really leaning on the connections that are available in different care facilities. So like you mentioned, kind of groups and eating together, and really encouraging that, and even encouraging connection with other people in the facility that maybe people haven't connected with. We all kind of get in our routines where we want to sit in the same chair and do the same sequence every day. And so sometimes even there might be connections even within a facility that people haven't explored yet, just because we are such creatures of habit. And intentionally even creating. So one thing I like to think about is, especially when folks are feeling anxious and depressed, and we can kind of get very much in our own head and stuck in our worries, is how can we reach out to somebody else who might also be dealing with worry and anxiety. And so especially in that setting, even encouraging them to ask questions of other people there, to get to know other people beyond kind of their initial circle of a couple different people they socialize with, to be able to connect and see how other people are coping, and maybe even just asking other people about their family members and to tell a story about a family member, and just really getting creative about kind of, even with the circles of socialization shrinking, how to get really creative with actually deepening those relationships.
That sounds, I think I might take a few of those recommendations back today. One thing that we see a lot in long-term care is dementia and cognitive impairments, and obviously PPE and face masks. It all plays kind of a significant role in how we're interacting with them. And just wondering if you have anything, if there's some research out there on signs and symptoms of detecting loneliness, with folks that have these underlying cognitive impairments and dementias?
I am not familiar with that literature, but I would say, especially in today's day and age with all the restrictions in place, I think it's a good assumption that most everybody is dealing with some loneliness right now. And I'd say almost taking that perspective of just assuming people are experiencing fewer social connections than prior to COVID. But the other things I've always, of course, to watch out for are changes in agitation, and like you mentioned, monitoring food and drink intake, those sorts of things, changes in sleeping patterns, changes in even wandering, those behaviors sort of can indicate a shift in how that person is feeling settled on the inside. So sort of that unsettledness, whether it's depression or anxiety, creates a shift in their pattern. So especially staff being able to know a person, know a little bit of their history, anytime they're starting to notice changes in their behavior, whether the person's just not acting like themselves, being more withdrawn, not eating as much, not sleeping as well, those sorts of things. And so it speaks to just how important it is having those good caregivers and staff and essential workers in place who really bring a whole lot of empathy and motivation every day to actually getting to know every person so that they can be able to recognize changes when they happen.
Wonderful. And I kind of one last question here as we're getting close to wrapping up. And maybe everyone doesn't know, but there's a lot of talk out there about unintended consequences of COVID-19. And I know we're talking, a lot about mental health, but could you talk a little bit more about some of the unintended consequences of COVID-19 on, healthcare and healthcare workers and our seniors?
Yeah, definitely. I think, especially within healthcare, even before COVID-19 hit, we've always talked about a healthcare crisis, that we just don't have enough healthcare workers, and of looking at rates of burnout. And I think one of the major unintended consequences to COVID will be driving those rates of burnout, because as healthcare workers and essential workers, the issue isn't that we don't care. The issue is generally that we care too much. And so signing up for long hours, trying to support everyone as best as we can. And then for a lot of folks also caring for people at home, whether that's kids, spouses, even pets, those sorts of things, being able to, being a little stretched thin during this time. And so I think for healthcare in particular, keeping an eye towards burnout. And I would say for that comment about people caring too much, for anybody on the call who is an essential worker, that being sometimes a key indicator of burnout, is that your natural tendency to care a lot starts to fizzle, and that you're not able to connect or be empathetic, that you just feel a little bit disconnected, especially from your work. And that being, for a lot of people, a key sign that burnout is happening. And then for seniors, the unintended consequence, I would say, is looking at that data around loneliness and social isolation, that we know that is such a big piece for long-term health, that even if we're protecting our seniors in the short term by, keeping them as socially distant as possible, protecting the seniors in our community so that they can get through this pandemic, my concern would be more the long-term consequences of that increased isolation and those pieces, that we might see kind of worsening of other mental health. And there's even starting to be some data around that, of kind of worsening of, diabetes, weight gain, those sorts of things, that are starting to be seen with the COVID pandemic, that people are starting to have a bit more of a decline in their overall general health.
Wonderful. Well, I think you kind of hit on all the topics of the questions that I thought might be important to address with the group. And I don't know if we had some time, if there was folks that wanted to ask some questions.
I just checked the chat and I didn't see that there were any questions chatted in. So unless anyone has a question that they want to unmute for or quickly type in. I'm gonna 1 second here.
This is Linda Simmons. I'm a social worker case manager with the SDMI waiver, so I'm definitely clued into mental illness, and plus I have an elderly mother, and one of the unintended consequences for her was the cancer support group that was held locally at, and I can't recall the business, but due to the pandemic, she had to shut her business, and therefore the cancer support group ended. And that was like one outing a month, I think, for my mom, who doesn't get out much. And so I just was going to mention that that was an unintended consequence of this pandemic for an elderly person. So anyway, thanks for this, though. I registered for this at the last minute. It was wonderful. Thank you for providing it.
Thank you, Linda. And I do see, did you want to add something to that piece? Anybody? Okay.
I might add too, that is something that we're seeing is even though telemedicine is widely available, some people just are much more comfortable doing it face to face. And unfortunately, it's more limited these days, those options. I even have lots of folks who, used to attend AA meetings regularly, and a lot of that's gone online. And so just a lot of folks, especially not feeling comfortable navigating the online world of online support groups. There are plenty of seniors who are, jumping in 2 feet in of doing, online silver sneakers, et cetera, lots of those things. But for some people that also can be very, very alienating, that don't feel comfortable being able to navigate telemedicine or group support online.
That's great. There's also kind of reiterating that the canceling of support groups has been a challenge. And there's a question for Amy. Are family members permitted to visit relatives where you are? What does that look like?
Yeah, so it looks a little bit more creative than it used to. I should say that. So regulations are changing daily. Actually, 2 days ago, the feds came out with new regulations for inpatient, like face-to-face visits and allowing visitors in long-term care settings. So it's kind of a tough one to answer. So we are doing compassionate visits, which can be, maybe family members that, live out of town and they are traveling to see their loved ones, and then also end of life compassionate visits. So that's what has been going on. And then everything else has kind of been like a window visit, or we're using a lot more iPads and other technology to assist with keeping folks in contact. So I think all long-term care facilities and assisted living facilities, their policies are changing kind of quite quickly. So I would recommend anyone reach out to their local facilities that they may have relatives at to see what their current visitation policies are. And so it's changing quite quickly, and everyone has to kind of meet certain guidelines for that to open up. So hopefully we will be seeing more of that in the near future, but it is still a little bit limited right now.
Thanks, Amy.
Yeah.
And I don't see any further questions, so we can end there. Thank you, Amy and Dr. Ross, for your time and for sharing the valuable information and recommendations with us today.
Thanks, Haley, and thank you, people.